November is Lung Cancer Awareness Month, and awareness, of course, is key, as it is the leading cause of cancer deaths in the U.S.
Yeah, but often, people with lung cancer don't know they have the disease because symptoms don't appear really until advanced stages. I spoke with a lung cancer specialist from Frederick Health on new guidelines designed to catch the cancer sooner. It's what's going around. Dr. Mulhern, lung cancer is one of the most common types of cancer. Why is it so hard to treat?
Excellent question. One of the reasons that lung cancer is so hard to treat is, well, multiple reasons. First off, there are different types of lung cancers. Some of them we have really good treatments for, some of them more developing in the treatments that we can offer for those types of lung cancers. I would say probably the most trickiest part of treating lung cancer, though, is the fact that usually if it's in the early stage where it's the most curable, patients don't necessarily have symptoms of the lung cancer at that time. Once the symptoms start, that can sometimes be a sign that that lung cancer is either started to grow or even started to spread into other parts of the body.
What are some symptoms of lung cancer?
So symptoms of lung cancer that we tend to see is a cough that doesn't necessarily seem to go away. Sometimes the cough, just despite other treatments for cough, tends to worsen and worsen over time. Sometimes there's blood inside of the sputum of the cough. Those are all great reasons to, see a doctor, a pulmonologist. Sometimes the symptoms can be vague. Maybe you completely lose your appetite. Maybe you start to lose weight and you can't really explain why you're losing that weight. So those are probably the most common ones that I see.
Dr. Mulhern, what are some of the new guideline screenings for lung cancer that have been put out in the last couple years?
Yeah, great question. So as of 2021, the United States Preventative Service Task Force, which is essentially a body of physicians that looks at the data, figures out ways that we could potentially catch cancers sooner so they are able to be treated. So they put out new guidelines as of 2021 to try to catch more people in the earlier stage of lung cancer. In the past, the recommendations were to start screening people at 55. We've since lowered that down to the age of 50. Another thing that we've decided to do was change how many people we should consider for screening based off of how much they smoke. So in the past, we did a 30-pack year history. That's now down to a 20-pack year history. And a pack history is actually very easy to figure out. All you have to do is take the number of packs that you smoke in a day and multiply that by the amount of years that you've smoked. So if you're smoking 2 packs a day for 10 years, that would equal a 20-pack year history.
Dr. Mulhern, thank you very much for spending some time with us and lending your expertise. Thank you. Very informative.
Of course, I appreciate the time as well. Thank you.